Mayor and Council, KT Freeman, Fire Chief. Thank you again for your time today. I've got 4 objectives that we're going to be going over with you and the council, and we do have a PowerPoint presentation as well. And as we get into this, Mayor and Council, we're going to be discussing some detail in just a little bit of how effective, because you've supported our efforts, and the city managers has also supported our efforts to have our own public health authority. This week, it played out in a real situation that affected not only our community, but some of our employees as well. So we'll talk more about that. Dr. Martin will discuss it. So today we're going to be going over, giving you an update on our testing center, our COVID-19 statistics, our public health update, as well as our future strategies on what we believe it creates a clear path on how to move forward. So this time I have Dr. Martin. Dr. Martin's with us, Chief Jones and Chief Davis. And in our usual format, we're going to be sharing and presenting from different perspectives. So each one of our staff will be presenting. At this time, I'd like to ask Dr. Martin, if he would, to talk about how over this last week or so, we've been able to work more collaboratively and collectively with THR Hughley, as well as THR Burleson, to begin to more solidify a plan going forward that will expand our partnership with Hughley, which will ultimately expand our testing center capabilities as well. So if we move to the next slide and then have Dr. Martin come in, that'll be helpful.
One second, I think he had a camera issue. He'll be right with us.
Okay.
I think he's muted.
There you go. Thank you very much. As I try to learn the process that you all are very familiar with, but I'm not. Thank you for tolerating my novice ways. When we started the drive-through testing first week in April, it's been now about 5 weeks. We've had a relationship with Quest Care in the community and with CPL Labs and THR Burleson to try to put all this together, and they've done a very admirable job of doing the testing here at the Brick in Burleson. And but as we've matured in the testing, we've run into a few things that we felt like needed to be looked into more from a long-term basis. Looks like this disorder is not going away in the time frame we had hoped it would, and so the need for ongoing testing locally, nationally, is still there, and we wanted to look into a longer-term relationship at the time that we have this really fine facility, THR Hughley. Not only does it represent the Adventist system, but the Texas Health Resource Hospital, 2 very quality groups. They have a very quality lab there that is run very efficiently by their lab director, who has become an extremely accountable individual for us. Even as recently as this past Sunday, when we were trying to determine what the risk for our golf course was, with one of the employees there was notified that her mother tested positive for COVID. So the golf course staff alerted her and asked her to go home, which was the right thing to do. And that this past Saturday, and then Sunday, we actually had her tested 7:15 on a Mother's Day morning, and by 4:30 that afternoon, we had her results, which is really profound for me and for the city and for all we work with, to identify the individual promptly and then take further action as we did with the golf course to actually close the facility until we could understand the gravity of the situation and try to do corrective and remedial actions. But going back to this relationship, we have been very pleased, and it seems like the Hughley staff are very willing to work with us as a city, and to the point that we are leaning more and more toward a relationship with them, and them with us, because they have particular needs too. Now that Hughley is starting back into doing elective surgeries and surgery, they have to do pre-operative before they do surgeries. They have to have clearance of the COVID testing with all those surgical patients, and so they're doing a lot of testing there, and would like to use our drive-through facility here at the Brick to help facilitate some of the testing that they're having done for their patients. But we had talked about salivary and nasopharyngeal testing, the difference between the two earlier, and we were leaning towards salivary testing if it were available. But it's not so much the testing, but it was the test being run by a certain lab in Lubbock, and that kind of fell through for the Hughley Adventist system. They got very tardy and slow, so and I'm not sure they developed a confidence level. Something happened there in that relationship, so they had to terminate that relationship and gone back to nasopharyngeal testing at this point. But we think that they do it. We think they do that testing in a way that may be superior, possibly to the way we're testing. It's just the technique and the style that's being done. We have confidence in the people we work with, but we just, I think from a quality standpoint, there might be some technique differential between the way Hughley does it and the way the staff at QuestCare does it. So we kind of looking at that cautiously to see. We want to limit the amount of false negatives that we have. The salivary testing is still on the boards for us if it comes available with a confident brief turnaround like we had hoped for. As it is right now, we're getting about a 48-hour turnaround by working with Hughley, which is easily 24 hours better than working with CPL Labs. So we're pretty well doing all our nasopharyngeal testing. Swabs are being sent to Hughley just this week as we try to get a better turnaround time. And it's been very helpful to us. The other, as you might have discussed this before, but Hughley is also able to electronically send a report immediately to the ordering physician or primary care provider, whether it be a nurse practitioner, PA, or a physician, directly to their computers, rather than us getting fax reports and then having to turn around and fax results back on all the tests, whether it be positive or negative. So that's going to be an advantageous relationship. And I think that's probably it, unless there's some questions about that or further comments.
Everybody good on the testing piece?
Yes.
All right. Thank you, Dr. Martin.
All right, Mayor and Council, I'm going to go over this next slide. I was on a conference call yesterday with Chief Nim Kidd, who is the director. He's running the TDM, Texas Department of Emergency Management. And what Chief Kidd had shared was Governor Abbott, in fact, all of the governors were apparently on a conference call. I believe it was Monday or it could have been as late last week, but nonetheless, all governors were on a conference call with the White House. And the White House has requested that all states to test all of the skilled nursing home facilities. So that would be all facilities that are licensed right now as a nursing home. There are some facilities that carry multiple licenses, assisted care, memory care, and then nursing home. But right now they're going to focus on licensed nursing homes. Chief Kidd said that eventually the goal, and he believes in the near future, will also be asked to test all residents and staff in the assisted living as well as memory care facilities. But the ask right now, specifically from TDM to all the fire departments in Texas, fire leaders, was simply to ask for support. They need to get this done. They've committed over the next 12 days, and the time clock started actually Monday the 13th. And the goal is to have all licensed nursing facilities tested, the residents and the staff, no later than May 25th. And the state will pick up the tab for all expenses and provide the test. One of the things that we committed to certainly is that we will do that. We've already participated once before with our local facility, that the staff and residents have already been tested based on a previous incident. So I want to share with you, Mayor and Council, that we have accepted that request. We're already in the process of working with our applicable facility. And I think it's really encouraging and fulfilling that the state now is starting to push things down on a very granular and operational level to fire departments and to the public safety aspect of our response capabilities to get these things done in a very timely manner. And I was able to share, again, the support of you and the council and our city management team, that we are very unique and we're very fortunate in that we have our own testing site, we have our own public health authority, and then the collaboration that we've been able to do with Tarrant County Public Health as well as our THR partners. And that was well received. And I said, we're so blessed here. We're small, but we're very effective and we're very efficient. And we understand one size, doesn't fit all. But this just plays right into our wheelhouse. And so I just wanted to share with you and the rest of the council members that we will have this done prior to the deadline that has been given to us. And so, again, it's fulfilling to play a positive role. And there's certainly going to be more coming down the pike. We expect it based on the conversation yesterday with Chief Kidd. Any questions that I could answer on that? Okay. So I think Chief Davis is going to give us take it from here on the next couple of slides. So Chief Davis, if you would you go over the testing center?
Yes, sir. Mayor and Council, thanks for having us again. And just want to go over the testing center. This is the same slide I've been showing you from week to week. As you can see here, we are continuing to trend out with the tests that we're offering to the community. So far, we've tested 585 patients. 215 of those have been Burleson residents. And we've had 26 positive cases come out of the Burleson testing site. This here is another slide I've been sharing with you from week to week. If you can see here, this the yellow there, that's our total cases. That we're up to 48 total cases. This here in the blue is our recovered cases. And then down here in the red, that's our active cases. So I think it's important to pay attention to the active line. That's the active number of cases that we're working on a day-to-day basis. So as you can see here, it's staying relatively, it's flat here as we go through this. Obviously our cumulative cases will continue to go up, and as well as hopefully as our recovered will continue to go up. But as you can see here, we are staying right around that 15 to 20 range is where we're staying with our active cases right now. This is another way to represent the numbers since we started COVID here. That we have 35% is in our active group right now, 63% is in our recovered, and then 2% deceased rate. I think it's pretty important to note that as we've been watching this week to week, it's been pretty consistent that the deceased rate has been about 3%. This week we've noticed as we did the numbers that it's fallen to 2%. And I didn't know if that was only because we've had one death here in Burleson, and obviously with those low numbers it can move the percentage around. But as I get to the next slide here, you'll see that for North Texas, we were trending about 3% from week to week. North Texas as a total is trending at 2% right now currently at the same time. So this is the North Texas numbers as they set at the moment. This decease rate is still higher than the flu. I don't want to minimize it by any stretch. That's still quite considerably higher than the flu death rate, but that things are going well. The social distancing things have worked. The mitigation efforts are working, so we want to continue to stay the course with our public health and keep the message out. These are some current numbers from Tarrant County. I always like to share with you kind of the hospital capabilities, what's going on with them. This is just a snapshot from some of the data from their website. The most interesting thing that I noticed from Tarrant County this week is it looks like there is a trend in hospitalizations, though. So as I get to the next slide, you'll see that. So right now, currently, their occupied beds, they have 5,300 beds basically, and 3,300 beds are basically occupied right now. So their available beds are 2,000. We were seeing them trend about 50% occupancy. So this seems to be up from what it has been. I'll move to the next slide here. So this is the interesting one. So the dark blue at the bottom is general isolation beds. So these are COVID patients in the hospital right now. The light blue above that is COVID patients in an ICU. And then as you can see here, the 7-day moving average, basically April through mid-May now, mid-April through mid-May, the hospitalization rate is up. I don't know what that attributes to, but that is we are seeing a trend up right now in the Tarrant County hospitals. So it's worth considering as things are opening up and we're looking at things. I think this is something we definitely want to pay attention to as we continue to watch.
Hey, Chief Davis.
Yes.
Todd Holsey here.
Yes, sir.
Would increased testing, which may yield an increased number of positive results, therefore perhaps result in an increased number of hospitalizations? Is that possible?
So I know as this thing has unfolded, basically since March through now, in the beginning when there wasn't much testing, they were going off signs and symptoms. If a patient had certain signs and symptoms, then they were confirming them as a COVID patient. And then if they got really in bad shape, then they would test them. As more testing has came along, we're starting to see where they're testing most all of those patients now. So all of these have been confirmed patients in the hospital. So I feel like this graph is pretty accurate since mid-April through mid-May now. I think they're trying to do a better job of making sure that they get away from just the signs and symptoms piece and that they are tested and lab confirmed. And Dr. Martin, please feel free to jump in on this question if you have more to add to this. But that is basically my understanding. In the first, it was more about signs and symptoms. And so now, especially coming out of flu season, it was confusing in the very beginning because it was all about signs and symptoms. And now it's kind of moved more to lab confirmed. So these are all lab confirmed patients. And then, with the hospitalization rate. So.
Yes, sure. Now, I might add that these are sick people. They're only in the hospital because they've been determined to be too sick to be at home. And the bulk of that, probably 80-90% of those that are hospitalized have the pulmonary complications. They're short of breath. Their oxygen levels are probably lower than they should be. And I can only speak from one hospital experience where they had 80 patients just as of last week. 20 of those 80 patients were on ventilators. The other 60 were waiting to see if they needed to be on a ventilator or not. In other words, their oxygen level was low enough, and day to day, it was just being determined if they could, whether they need to be ventilated or not. And the majority of those weren't being ventilated. But the 20, when you put 20 people on a ventilator in an ICU, that's a lot of folks. That's one hospital. So there are a small number of people that are being admitted for a brief time for IV fluids because we One of the aspects of this disease is a really bad vomiting, diarrhea, dehydration. And I've had several patients that I've followed here personally in the Burleson area that were admitted for intravenous fluid therapy because they got so dehydrated with the disease and might not have had the pulmonary or lung component at all. But the hospitalizations are sick people. They don't put them in unless they really meet criteria. They don't put them in just because they're positive COVID cases. They put them in because they're real sick. And so a good question, but I don't think it's necessarily a reflection of increased testing. These people call an ambulance or show up at the emergency room because they're short of breath. And then some of them are then determined to be COVID positive. What I do caution you about is the numbers that show there are 2,000 beds available. Those are regular floor beds, and they're not putting COVID patients out on regular floors. What's a better indicator, not reflected here, is our intensive care unit bed capabilities, how many actual ICU beds are open, or how many what we call step down beds, where a person is placed on a monitor, maybe not in the ICU, not out on the floor, but in a step down unit where they can have a cardiac tracing and oxygen levels. I probably got into this far more than you wanted to know, but I just wanted you to kind of get a feel for what goes on in the hospital itself with these patients.
Okay.
All right. Thanks, Doc. Thanks, Chief.
You bet.
Yes, sir. Okay. So give this back to Chief Freeman.
Yeah, I'll just, and thank you, Councilman Hulsey, for that. That's a very, very good question, and there's some real clear lines that the Dr. Martin always does, I think, a good job of helping to put it in perspective and explaining. I want to hand this back over to Dr. Martin here in just a moment, but I want to share with you, Mayor and Council, that in some of our previous briefings, we had shared that we were having significant challenges, significant, I don't want to say roadblocks, but just we weren't able to get the data in a timely manner. It wasn't accurate in the sense of patients were already being released, that they were still under Dr. Martin's orders. So last week, Chief Jones was able to go down to Austin and have some very important communications at the levels that were necessary, but other efforts communications may have also been going on as well. But I'm pleased to say that because of the efforts and because of the collaboration and just staying after it, even I think Monday, Dr. Martin was in another communication with the director of DISH's Region 2-3. We feel like we've crossed that line. We've made significant inroads that we're now going to be able to enhance our capabilities and the services provided to our community. So, Dr. Martin, would you please take it from there and share the different talking points?
Sure. And we've come a long way with our relationship with District 2-3 and the leadership there, Dr. Massey, and they're very good epidemiology group. And the issues that we had at hand were delays in those people we test here. We get reports on promptly. It's the people in our community or in the city of Burleson who are tested by maybe an outside of our testing system, where those reports go to the state first, and then back to our district level, and then down to us. So there's some delay in us getting those reports, those positive reports, and built into that is a delay then in the contact tracing. So we had a discussion with them, and there's some inherent problems that we're still going to have some challenges with on those, but we're all going to continue working on that relationship at a state level and at a district. I say district. What is the term? Our 2-3. What is regional level, which includes Johnson County and other counties that are not near as big as Tarrant and Dallas County. So that was good communication. we wanted to identify and be sure we had the roles for their epidemiology group to continue to assist us until we have a epidemiology contact tracing group in place here. Mike had some extensive discussions with Heidi, their chief epidemiologist, and they've got a very good working relationship. We can pick up the phone and call them, particularly when, like with the golf course issue, we wanted to let them know promptly about it so they could do the contact tracing and assist us with that. So the epidemiology aspect of it, we wanted to define those roles, who was doing what at our level here, and what we were asking the 2-3 office, regional office, to help with. And from that, we have no problem isolating the individual promptly and quarantining the home. It's just outside of that area. The contact tracing begins to be more tedious, a bit more burdensome with contact because you have to sometimes contact 1 to half a dozen people or more by phone and let them know what's happening and get them quarantined. So that becomes a more extensive problem. And we're still asking the epidemiologist at a regional level 2-3, and who Mike shares the information with on a regular basis. And it's working well. I think it's working well. The third thing we asked to get clarification with is there had been some confusion about when an individual had successfully gotten better from their illness and could be released from isolation. There was some kind of form letters that were being sent out to these individuals from the state through our regional office that were releasing them somewhat prematurely at a time that they might still be ill. And so we asked permission from them to, or just said, why don't you just let us do that for you? Because we don't have large numbers here. When we're tracking 15 to 20 active cases, we have the ability to contact them on a regular basis to see if they're ill or not. And what we've discovered is that this illness is not always over in 10 days or even 2 weeks. Sometimes the illness can go up to 3 and 4 weeks in individuals, not the majority, but there's definitely individuals that can last 3 or 4 weeks, and they are still shedding the virus. And we don't want to prematurely release those individuals out in the community to infect others. And so they have conceded that to us and said, please take that. Just let us know what your game plan is. And so I think we've gained some confidence at a regional level and maybe state level that we're capable of handling our population. Our next big step is epidemiology, and we've already begun to have some preliminary talks with a candidate. We may wish to bring a candidate to you at some point after we do some vetting here, but we're really quite excited about the candidate. We're just hoping things will work out to place that individual here and give her some assistance that she may need to help us do the boxing in that the governor wants us to do, and what's successful by bringing all these people under a close corralling effect so that they're not let out in the community to infect others. And that's it. Those were the 3 items. But it was a very productive meeting. I'm glad we had it. And Mike, I might also say that Mike and I went down to Tarrant County Public Health Department this past Friday and got to witness how they do their contact tracing. Went inside their system there with their chief epidemiologist, Russ Jones, and got to actually see their computer program where they do their contact tracing. They actually have 2 large rooms set up with multiple computers, and they use University of North Texas medical students and others to help collect all this data and information and do the contact tracing. It's really impressive how they've done that, and it's really good to have them this close by, because they're willing to help train us on their system that will make us more efficient with the contact tracing in the weeks and months to come. That's it from here. Thank you.
Mayor and Council, also I'd be remiss if I didn't acknowledge the help that we've had from State Senator Powell and her office, as well as State Representative Burns. I don't want to allude that we did this on our own. It was truly a collaboration at various levels to have the appropriate conversations and to share our needs. And like I say, we're very pleased that we are where we are right now. Lastly, we're continuing to stay with this strategy. This is a strategy given from Governor Abbott himself, and is straightforward. The testing, the box it in until something is promulgated to us that is different. It is testing. We're trying and working very diligently to expand our testing capabilities. Isolation, again, a great advantage that when we get these results back and we feel confident we're going to get them quicker now than we ever have before, gives Dr. Martin and the team a chance to issue isolation orders, talk to these people firsthand, very, very promptly. The tracing aspect, the find, we are working on that through the epidemiologist. When I present to full council Monday, a strategic overview of the fire department, I have part of my presentation will be some recommendations to the council and the city manager's office of what this would look like, our expanded needs to effectively do this. And then, of course, the quarantine portion of it is certainly very, very important as well. So this concludes our presentation for you, Mayor and Council, and be glad to answer any questions for myself or for the rest of the team here.
All right, questions, comments?
I have a few. First, I want to say thank you to Chief and the entire team.
Catherine, I think we're having some difficulty hearing you, or at least I am.
Yeah.
Can everybody hear me now?
We can hear you, but you're really low.
Okay. My headphones stopped working, so hold on. Let me see if I can bring it closer and speak into it. Can you hear me now?
It's still really faint.
Okay. Well,
But we can hear you, so go ahead, and if we don't get everything, we'll let you know.
okay. I don't want to spend too much time on, sort of the riffraff of, the conspiracy theories. But what I do want is to have some clarification as far as the contact tracing, because I've gotten several questions about that. Fairly simple, but the contact tracing is voluntary, correct? If someone chose not to participate in contact tracing, there's no armed force that's forcing them to give over this information. Is that correct?
Dr. Martin, are you still on?
Yes. Can you hear me?
Yes.
Okay. You bring up a very good point. And I will have to look into this. I'm not sure what kind of enforcement. We have had such a sense of cooperation from the community that it really hasn't, unless Mike, you run into that. I have not personally seen someone who wasn't willing to do their part in self-isolating. But the question is a very good one. What kind of authority would we have? I don't think right now we have much of any authority to force quarantine, and I don't think we're going to see that in this country unless we get to an absolute crisis. I just don't see that happening. Did that answer your question, Catherine? Yeah. It's a good one because it's the same thing, kind of like with the governor in the position of jailing someone if they didn't follow the rules, and then this thing blew up with the young lady who had the beauty salon who elected to take on that that question and was jailed, and then the rules changed all of a sudden. So currently we have, unless Mike or KT, anyone else is aware of any kind of enforcement that we have, I'm not aware that we can mandate that. We can only strongly recommend it be done.
Councilmember Redding, I think that there is a legal pathway for that, but it is not simple, and it is not something that obviously we desire to have to go down that road unless we absolutely had to. But there is a legal pathway for that. There is some legislation that allows for that, but it takes a judge's order and some things of that nature. But obviously our voluntary compliance, and we've been very successful at that so far. We haven't run into that issue.
The chief is correct. There is a provision under the health code. If there is an infectious disease determination made and a health authority directs a quarantine order, if an individual refuses to follow it, we have the remedy of going to a judge and securing an order requiring them to stay quarantined. If they fail to do so, it's a contempt event and they can be placed in custody. Obviously, it's a much more cumbersome process, and it doesn't work through what we normally do at the local level. The county would be the enforcement agent once we reach that issue. And I'm not aware of it happening anywhere in Texas during this pandemic.
By the way, I think it's one of the benefits of us taking control of the testing, but more importantly, the contact tracing and containment, is that this isn't people coming from outside the community in to try to do this. These are this is our own community, and I think there certainly is a lot of trust that our fire department and other emergency management folks have built up in this community over generations. So I would absolutely expect that we'll continue to see the kind of voluntary compliance that we've seen so far. And that, that trust is hard earned and I think has been earned, through the process of the response to this particular public health emergency as well.
I agree 100%. I think it's important to have it sort of, put that out known that we want to work together with our law enforcement. Okay. So the only other question that I have is, you mentioned that some will hold the virus for 3 to 4 weeks. Some will hold it for 10 days. Is that being determined by our Burleson testing and continuing welfare checkups, that the virus can be prolonged for that amount of time? Or how did we establish that the virus could last for 3 to 4 weeks? Granted, it's not in the majority, but how is that determined?
Well, it's usually, we actually have a telephone callback system. Me or Mike will, bulk of that's I'm able to do currently, but we'll go through a checklist of symptoms, and you can almost hear it in their voices when you talk to these folks. But you go through a checklist of symptoms. It's mostly cough, shortness of breath, fatigue, temperatures, and people are usually readily to admit to you, and you can tell in their voice almost that they're feeling better. And I have a lady we've been following for now our 4th week. She's in her 20s, and she'll have a temperature for about 3 days in a row, low-grade temperature, feel bad, and then feel good for about 3 days, and then feel bad for another 3 days. And it's kind of episodic. It's really interesting, and it's intriguing to watch her. She's might going to have to be tested specifically for other disorders if we don't see. But we're working with her doc, and but we've seen this happen probably about 10%, roughly, of the people that I've been talking to will have an extended time frame, and you'll probably talk to others, friends or acquaintances who may have had a protracted course with this. But we're going on symptoms mostly. There are some of the individuals that are healthcare providers. We do have to, a number of those we do have to retest, and actually sometimes we will find they're still positive 10 days or 2 weeks into their illness, and they don't feel good. And so we know that they're probably still shedding the virus. But probably the bulk of people do recover in that roughly 10-day time frame from the onset of their illness. Does that answer your question? It's done on clinical measures, mostly asking questions and deciding when we feel. And actually, the CDC has some parameters to go by, which include normal temperatures and how are you feeling? Is your strength back? Is your cough improved? Are you short of breath? I mean, we have about 6 or 8 different questions we ask, that helps us determine if they're still likely shedding the virus or not.
Councilmember Reddy. Thank you, Dr. Martin. Councilmember Reddy, I'd also like to add to Dr. Martin's point. There's at least one other case that comes to my mind that we know started off with our testing center, that the positive came in, and we haven't followed up on this case in about a week, but 4 weeks later, this person was still tested positive 3 additional separate times. So it might be the anomaly, but it certainly is possible that a person, even 4 weeks into it, was continuing to retest and still test positive as well. And that case was identified through our testing center. So again, it was good work, so to speak.
Okay, do we have an idea on the reinfection rate? Have we been able to get any analysis for that?
I'm sorry,
I didn't
hear your question. I'm sorry, I had my...
The question is, do we have any data on the reinfection rate?
Oh, Dr. Martin.
Yeah, that's, I haven't really seen that here yet, but we've had 40 some odd cases. And so it's been described, but you begin wondering, well, were they truly reinfected, or were they just not over the illness to begin with? Were they just still harboring organisms that came back? And so it's been seen out there and described, but I personally have not seen it at this point. I mean, there likely will be cases. We're still learning so much about this disease, and so I would not say never. But we're definitely going to see some people who really struggle getting over it or might have a recurrence.
All right. Any other questions?
Mayor, I just wanted to add, unless there's other questions for Dr. Martin or the fire department, I do have some other information that we wanted to go through with the council related to COVID-19. Robert's got information on some of the facilities, the brick that we wanted to talk about. And then finally, we wanted Matt to go through the declaration that's under consideration.
Sure. Just before we do that, I want to just express how appreciative I am that we have made the progress we have with DSHS. And I know that is because of, a lot of perseverance and diligence with our staff. And then I want to echo appreciation to Senator Powell's office and to Representative Burns' office, because they've been dogged on this as well. But I'm really excited about that progress, because I think it is key. And then to Catherine's point about voluntary compliance, I'll just add the testing to that as well, because I think one of the things I'm going to be talking a lot about in terms of advocating for resources from the state, federal government, is that we have to get to the point where testing is more readily available and more widely available. But that will always be on a voluntary basis. So even as we talk about expanding these things, it really is reliant on voluntary compliance, which has been great in this community, and I expect that it will continue to be. But thanks to Chief and Casey and Dr. Martin for a really great report. And maybe staff, maybe our communications department could really just pull out a video of this portion of the meeting, that report, and make that available online, because I think there's lots of information there that's it would be really helpful to our residents.